Good morning, folks. Ron Ray here with Turning 65 Solutions. Today, we are going to continue our series that we've been working on, Medicare Explained Simply, because Medicare is confusing on purpose. Medicare Part A, Part B, Part D, Part C, Medicare Supplement Plan A, Plan G, Plan F, Plan N, high deductible G, all this alphabet soup. And what is it? You're supposed to be able to make sense of it on your own. Well, that's not the case. I'm here to explain it all to you. I work for Turning 65 Solutions, tax and insurance, Medicare and health insurance advisors, and we help people understand Medicare and make wise decisions as you're approaching 65 and beyond. So we'll get into it. I always like to go with a good non-biased third-party source. So today we have this booklet right here from the government called Choosing a Medigap Policy. This is the 2025 version of this book. You can get this online from the Medicare website. I'll put a link down below so you can get it yourself in the video description. You don't have to go searching the Google box for it. But also, it's right here, and we're gonna skip ahead because we've already covered a lot of this. We're gonna go to a page that's got a chart, and we're gonna talk about what Medicare supplements actually do. And this is the page we're looking for right here. Now, Medicare supplements, these are also called Medigap plans. These go along with or alongside of original Medicare A and B. So remember, in the last video, we talked about Medicare Part C. That's where you combine A, B, and sometimes D into one separate plan that's operated, administered by a private insurance company. And Medicare, at least for that calendar year, is kind of out of the picture. They've contracted you out to this insurance company, and they're administering your health care for you. With Medicare supplements, it works a little bit differently. You see, you keep original Medicare A and B. They pay what they pay. We've talked about that in the previous videos about Part A and Part B. Call it 80%, maximum of 80%, and that leaves behind at least 20% for you, depending on if you're in the hospital, if you're outpatient, but call it 20% for your share. Medicare supplements are designed to pay a portion, if not very close to all of your share of the Medicare bill. So Medicare pays their share, your Medigap plan, your Medicare supplement pays your share. Now, there are a couple of plans that are fully comprehensive, but you have to go back a ways to get to those. You have to be a little bit older. You have to have been in Medicare for a few years now. And we're going back to at least 2020 when they kind of discontinued issuing these plans to new people coming into Medicare. And that would be the Plan F. A Plan F, it's still listed here because people still have a Plan F. And if you were in Medicare prior to January 1st of 2020, you can still get a new Plan F from a new company if you like. But it's still listed on the page here because it still exists and people can still get them. A Plan F covered 100% of your share of the Medicare bill. So if we're looking at these parts here, Medicare Part A, all right, that's their hospitalization. Medicare Part A deductible, that's $1,736. Part B co-insurance or co-payment, that's that 20%. Part B deductible right here, that's this year $283. Part B excess charge, that's that extra 15% that we talked about in the Part B video. That's above and beyond the 20% that you're already paying. Well, Plan F covers that as well. And it covers skilled nursing, hospice, first 3 pints of blood. It covers a bunch of stuff. In fact, it covers everything as long as the procedure or the event, the surgery, the test, the office visit, as long as it's approved by Medicare, the Plan F is going to pay your share. Now, I want to reiterate You have to have already been in Medicare Part A prior to January 1st of 2020 to get a Plan F. But I think it's important to cover here because a lot of people are still in that area, and a lot of people still have a Plan F or may want a Plan F. But for everybody that's coming into Medicare after January 1st of 2020, it's now May of 2026. We're a little bit down the road. A Plan G is the most comprehensive, and that's what we'll talk about now. Plan G pays everything that a Plan F pays, except for, you can see it right here, that Part B deductible, which currently in 2026 is $283. So that's your share for the year, a $283 annual deductible. After that, a Plan G takes over and pays 100% of your share of the Medicare bill after that deductible. Currently, the most comprehensive, the most trouble-free, the most predictable plan that somebody new to Medicare can get. Plan G. Now, the little asterisk right here, that represents a high deductible Plan G. Plan G, high deductible Plan G comes with a $2,950 annual deductible. So once you meet that, then the Plan G, high deductible Plan G, takes over to 100%. So with the high deductible Plan G, you don't have a $283 deductible. You have a $2,950 deductible. But remember, Medicare is still paying first. So they're still paying roughly 80% of the bill, and you're only paying 20%. And if your 20% gets to $2,950, well, then you're in the clear. So it's a good idea to do some math and figure out what the cost savings is on a high deductible Plan G versus a standard Plan G, and see if that feels like a good savings to you if you can go a couple of years without paying that deductible. So that's a Plan G. Plan G is currently the most common, certainly the most popular among our client base here at Turning 65 Solutions. The other plan here that I want to note is the Plan N. The Plan N is another very popular plan currently. Plan N works pretty much like a Plan G. It pays everything except for the Part B deductible. You might also have a up to $20 copay at the doctor's office, $50 at the emergency room, and that's up to, and it's not mandatory. The doctors don't have to bill it, but they can, up to $20 per visit, $50 at the emergency room. The big kicker here, and the one to watch out for, is the Plan N does not pay that 15% excess charge. So remember, we said the Plan G pays the 15% excess charge. The Plan N does not. So that's your big risk with a Plan N versus a Plan G. The $20 copay for most people, that's not a big deal. You're not going to be going to the doctor more than once a month. Hopefully, if you are, then we'll probably do the math and figure out that a Plan G is better for you than a Plan N. But it's the 15% Part B excess charge that we need to watch out for. Statistics tell us that only a handful of doctors who are allowed to charge this charge actually do it. And so it's unlikely that you would ever have to pay the 15% excess charge. It's not impossible. It certainly can happen. However, it's usually avoided just by asking the question of a provider, do you accept Medicare assignment? Are you a participating provider? And if not, do you bill the Part B excess charge? And if they tell you that they do bill the Part B excess charge, then you can go find another doctor that doesn't bill that Part B excess charge. Or if you don't want to have to worry about doing any of that, then you just go with a Plan G. The savings in your premium that you're going to pay on a monthly basis between a Plan G and a Plan N can be pretty significant. And if you're not worried about the risk of that Part B excess charge, then a Plan N might be right for you. There's a whole bunch of other plans. There's 11 in total: A, B, C, D, F, K, L, and M. These plans don't come into play very often at all. We're really just dealing with the Plan G, the Plan N, and the high deductible Plan G. For anybody coming into Medicare after January 1st of 2020, that's now been 6 years ago, these are the plans we're dealing with. Remember, Medicare Supplement, also called Medigap, works alongside original Medicare A and B. Medicare pays first, Supplement pays second. Unlike Medicare Advantage, Part C, Medicare A and B they sit on the sidelines, and your Medicare Advantage plan administers everything for you, but now you play by their rules. So now you have to go to their doctors and get their authorization for anything that you need. With original Medicare and a supplement, the insurance company has no say in what services you get. If Medicare approves it, the insurance company is obligated by law to pay that bill on your behalf. In fact, the doctors don't even bill the insurance companies. They bill Medicare, and Medicare, through what's called electronic crossover, then sends your share over to the insurance company, who then pays the doctor. So there are no networks. You can go to any doctor or any hospital that you choose as long as they accept original Medicare A and B. That's the only requirement. And when you go, there's little to no out-of-pocket cost. Once you meet that $283 deductible with a Plan G, you're done paying for the whole year. No copays, nothing else. And no managed care. What the doctor orders is what you get, as long as it's Medicare approved, and that's almost everything that we see with seniors gets approved. There's a few exceptions to that, timing, certain things that may be experimental or just not approved by Medicare or the FDA or whoever governs these things yet. But for all of your normal stuff, you don't have to get permission from the insurance company. You just have to make sure it's in the Medicare schedule of approved procedures book first, and the doctors know that, and they'll look it up first, and they'll follow those guidelines. But we don't have any of those prior authorization problems that we have with Medicare Advantage plans. Folks, that's Medicare Supplements as simply as I can explain it in a few minutes here. If you have any further questions about this, please give us a call. The number is 830-217-6711, or look us up on the web at t65s.com. If you found the information in this video helpful, please give us a thumbs up down below. That helps YouTube get this video out to other people who are seeking the same information that you were today. And don't forget to hit that subscribe button so that you can be notified when we upload a new helpful video. Until the next video, folks, we hope you have a great day. Bye.